other thing that I really like about the technology behind it is the Smart on FHIR platform, right? I don't know if platform is the right word for it, but essentially the ability to connect to these mobile apps instantly, and it really is, I think, the first standard that encourages mobile applications and innovation outside it. Like it's built for a very new and modern technology stack, unlike those before it. And have you been seeing a lot of people kind of leverage Smart on FHIR, or is it still in like theoretical phase, and especially when it comes to aggregating all that data to like population health dashboards and stuff like that? Are you seeing it like being used regularly?
Depends on the country. I think, for instance, here in the Netherlands or in, I think in Northwestern Europe in general, it's not happening a lot yet. But if you look at the US, it's really going, you see real examples there happening, and their apps are being built that use these protocols that you just mentioned. And the secret here is, and I think if there's a lot of entrepreneurs here listening to this interview, the nice thing is that FHIR or Smart on FHIR, let's put them all together, and let's say FHIR enables these entrepreneurial ideas to be realized, because now you can all of a sudden, you can think of an app that does this magic, this one little magic trick in that really eases the life of the doctor or the patient. And you can build that app and launch that app, use that app with the data that sits in the EMR. And those things weren't possible before FHIR because you couldn't get to the data in an easy way. And the API, the FHIR API, allows you to retrieve that data and to actually build that app and put it in the hand of the doctor or the nurse or the patient. So I expect a lot of innovation happening when the entrepreneurs, the startups, start thinking of, oh, hey, now that I can get to the data, what can I actually do to it? I think similar things are happening in fintech, where you now have here in Europe, I think, I'm not sure, it's probably popular in Egypt as well. But now you have this PSD2 initiative here in Europe that says that's all about open banking. So your financial data, if you allow a third-party app to get access to your data, then that third-party app could be, well, could be anything, could be your household budget booklet or whatever, So there's a whole range of apps now who come into existence because banks are opening up their financial data. And one example here in the Netherlands, which is extremely popular, is called Tikkie, which is an app which is basically, it's a payment request through WhatsApp. So I can send you a WhatsApp message with a link and say €6, please pay me €6 because of we had a drink, whatever. And then you click the link, you're directed to your bank app, and the money is transferred to my account with just 2 or 3 clicks and one code that identifies me. So you see the same mechanism happening in other industries as well. And we'll see similar things like the Smart on FHIR apps happening in healthcare. And I think that the imagination of the entrepreneurs who think about these apps and who think about, oh, but this is how I can make a company, that will spark innovation. Absolutely.
And I like how you balance that with earlier talking about how it's really hard to build a digital health company. Like I haven't spoken, and I've interviewed many entrepreneurs, and in like the 7 or so years I've been in the industry, no one in healthcare has said, it's easy. Like everyone finds it incredibly challenging, and it's really refreshing to be seeing like technologies such as these actually spark innovation rather than be an obstacle to it, because everything else is an obstacle everything else seems to be a challenge, and you're gonna hit a wall.
Yeah, if you like innovation the hard way, then please join us in healthcare.